My name is Shaun Treweek, and I'm a Professor of Health Services Research in the Health Services Research Unit here at the University of Aberdeen. Randomised trials are very important. In the days before we used to do them, the way people heard about and started using treatments went something like this. I am Dr. Very Important of Harley Street, London. My Gold Coast elixir will cure you and your family of aches and pains, shortness of breath, excess wind, and the effects of aging. It can be yours for only £1 a bottle. And then people would start using it. Perhaps it worked for some. If you were lucky, it probably did you nothing at all, neither good nor bad. But some people were certainly harmed. Early treatments for scurvy, for example, were often fatal. What a randomised trial does is give us a fair test of a treatment. Does this elixir actually work? Does it do what it says it does? And that sounds simple, and like all things that sound simple, it's a bit more complicated. And this module is going to tease out some of that complexity. The key thing that we want you to think about is this. When we ask the question, does this work? For whom does it work? Whose aches and pains are you interested in? What do they think is meaningful as a reduction in an ache or a pain? It's very often not your view that's important. If you have a policymaker who's interested in the question, should I be providing this care for people who live in my area, what will reassure that person that this treatment works, that it does reduce aches and pains, that it does reduce the effects of aging? These are the key things to think about. If a trial team ignores these questions, it is entirely possible to spend years of your life designing and doing and reporting a trial that actually nobody cares about. The results are irrelevant because you have not thought about those people whose decisions you are trying to support. Your trial will move smoothly from bench to bookshelf and into obscurity. Nobody will care. And none of us want that. Trials are hard work. We want them to count. And making sure that they count and making sure that they do support those decisions is what we want to help you with in this module and indeed this course.